Hi everyone, welcome to our Pilot Feasibility Studies mini webinar series. My name is Katie Meller and today I'm joined by Professor Gillian Lancaster at the University of Keele to talk about why it's important to have set objectives in a pilot study. Hi Jill.
Hi Katie.
So the first question, Jill, is why is it important to have set objectives in a pilot study?
Well, it's important to have set objectives for a feasibility or a pilot study that are different from the main trial. And we have to be very clear about that pilot trials should aim to assess feasibility in some way, and any uncertainties that are remaining concerning the main trial. The objectives of a pilot study or a pilot trial are not those of the main trial, and that is something that needs to be very clear up front. And secondly, the specific aims and objectives for pilot trials should be clearly listed because they guide the methodology that's going to be used to address each of these objectives. So for example, some objectives may be better answered using quantitative methods and others may be better answered using qualitative methods, such as when we're asking people about the acceptability of the intervention, for example. And thirdly, it's also important to list the objectives so that when the findings are reported, other researchers can learn from pilot trials to inform their own studies.
Thanks, Jill. So in main trials, we'll often see objectives split into those that are primary and those that are secondary. Do you think that we should also take this approach to pilot studies?
Yes, I do think it's a good idea. It's helpful to separate out the objectives into primary feasibility objectives and secondary objectives. The primary ones are likely to be the main feasibility objectives, looking at consent or recruitment rates, acceptability of the intervention, looking at the processes and the procedures in some way to make sure they're all working. And the secondary objectives relate to the clinical or patient-centered outcome measures, the data that's going to be collected. Keeping these as secondary outcomes reminds people that the pilot study is centered around feasibility of data collection and not the data analysis itself.
So those primary objectives, could you give an example of what primary objectives for a pilot trial might be?
Well, I've got a slide with a list of some objectives on that we can have a look at. These are objectives that were given in the literature when we were reviewing the literature for this 2004 study that we did quite a long time ago now. So these are some of the objectives we found in the papers we looked at. And I can just run through them quickly. These are just examples. There's many other reasons why you might want to do a pilot or a feasibility study. So one big reason would be to test the integrity of the study protocol, that everything's going to work well together. Another might be to get some estimates for sample size calculations, as long as you've got a reasonably good sample size in the pilot study to do that. We might want to pilot data collection forms and questionnaires for their understandability, that people can use them okay. We might want to look at the acceptability of the intervention, how it's going to be developed, tested, or do people need training in order to be able to deliver and assess the intervention. We might want to select the most appropriate outcome measure. We may have a few different ones and we're not sure which one to pick. So we might want to try a few out and see which one measures change the best. One important reason, one key reason for doing a feasibility or a pilot study is to look at recruitment and consent rates. We need to be sure that we can get the people that we are aiming to target in an appropriate amount of time to recruit them. And this is probably one of the main reasons that main trials fail. So it's important to look at that. And we may also want to look at the randomization procedure from the perspective of the patients. Are they wanting to be randomized? Do they understand what that means? Do they understand what that implies in them taking part in the study? So these are just some examples, and there are a lot more that people can look at.
Thanks, Jill. It's been really good to speak to you today, and thank you everyone for listening. Please keep an eye on our website for future mini webinars and other upcoming talks and events.